What is a nurse coach? A nurse coach is a leader in healthcare who promotes optimal health and wellness for all human beings. As nurse coaches, we are not afraid to ask powerful, thought-provoking questions. I take my patients or my clients on the journey to discover their best and healthiest version of themselves. Nurse coaching has a huge potential to bridge that gap between sick care and healthcare. Hey friends, I'm Nurse Coach Shawne, and this is my podcast. In this podcast, I will be sharing with you how to create a well and balanced life that connects with who you truly are. Whether it be a meditation or mindfulness practice, an insightful interview, or just sharing my own journey and expertise on different life and wellness topics. Hopefully, if you're listening, you will walk away feeling more aligned in your purpose. This is your permission to cultivate radical self-love. This is your encouragement to create a more fulfilling and vibrant life for yourself. This is your invitation to lean into your curiosity and intuition. Together, let's build a compassionate space through which to heal. Welcome to the Aligned and Well podcast. So I was going back and forth debating what to talk about in my first podcast episode, and I figured I would start with this topic from the get-go and answer any questions that I can about what I do. Whenever I have people reach out to me or connect with me online, or whenever I'm at an event or a social gathering and I tell people what I do, I get this question a lot. What is a nurse coach? So I thought it would be a good idea to record a podcast and answer this question and provide some clarification and some distinctions between what a nurse coach is and other similar professions like a therapist or a life coach or a health coach. So we'll first talk about the definition of a nurse coach. So I'm going to read the technical definition of a nurse coach as defined by the American Holistic Nurses Association, and then I will kind of explain further in my own words. A nurse coach is a registered nurse who has been trained to integrate the coaching mindset and skill set into their nursing practice and partner with their clients to support them in setting and achieving their goals in order to realize their healing potential. So that definition is pretty straightforward and also very generic. My own definition of a nurse coach includes that a nurse is a leader in healthcare who promotes optimal health and wellness for all human beings. It is someone who facilitates the experience of self-discovery and growth and helps inspire people to achieve the life they truly want for themselves. I think a nurse coach values compassion for the whole person, recognizing that each individual has a different and unique journey. As nurse coaches, we are not afraid to ask powerful, thought-provoking questions to help unlock a patient's true potential and allow them to step into their full capabilities with confidence and support. I believe as a nurse coach, I am someone who models self-care and self-development, optimal health and wellness in my own life. And I take my patients or my clients on the journey to discover their best and healthiest version of themselves. A nurse coach acts as a guide. And, we help create roadmaps for individuals who have a deep desire for lasting change. We are agents of transformation both within ourselves and in our patients or clients. And I think it's really cool because just like in nursing school, how we learn about the nursing process, there is also a nurse coaching process that we learn through certification. And it can be structured in a lot of different ways to help different populations of people. It can be utilized in hospitals to help improve retention of hospital staff, the nurses, doctors, respiratory therapists, CNAs, all healthcare workers. It can be, what I do in my private practice, helping individuals and hopefully eventually groups improve their overall health and well-being. Insurance companies can even utilize nurse coaches to help decrease the cost of disease management, and nurses can use this at the bedside in the hospital with their patients. So there's so many different ways that nurse coaching can make an impact. I do want to talk a little bit about the main difference between a nurse coach and a general life or health coach. And the main difference here is the integration of the professional nursing and medical background and the training that we receive in the nurse coaching process. So the way that I have learned to integrate coaching into my nursing practice is to look at each individual from a holistic perspective. Everything is interconnected. And this holistic view really allows us to hold the client in leadership and see them as the expert of their own health. We're not trying to give them the answers. We're not trying to give advice. We know that ultimately every person knows what is right for them and what the right next step is. So that's, I think, the main difference between a nurse coach and a life or health coach. Now, another question that I get is, what is the difference between coaching and counseling or therapy? There are some similarities, but there are also a lot of differences that distinguish the two from each other. So I'm going to go into those a little bit. With counseling is more driven by the professional and is focused on helping the client work through past experiences and to help them gain more self-awareness of a current issue or a diagnosis. So if they are having anxiety or depression, counseling is a more formal structure and works to address those specific issues or diagnoses, process feelings and emotions, and then retrospectively understand past traumas or situations that affect their current state. Coaching, on the other hand, differs from counseling in that it is client-driven. So with nurse coaching, we are focusing on uncovering the client's deep desires and dreams for their life and their health and giving them the space to co-create that roadmap with us to achieve their best version of themselves through that coaching relationship. It's less formal than counseling. In coaching, we form a partnership with the client, and there's no particular agenda other than what the client wants out of it. So they are in complete control of the conversation, and everything in each session is based off of what the client needs to heal and to move forward to create their healthiest life. So I hope that clears up some of the questions regarding the difference between coaching and counseling. They are a little bit similar, but they're also very different. So now I want to talk a little bit about how nurse coaching has the potential to make a huge change on an individual level, at the healthcare level, and globally. So nurse coaching matters to me because it embodies everything that I've wanted to be as a nurse. I've always wanted to help people on a really deep and inspirational level. I have always wanted to be an agent of transformation and change and to learn how to implement health and wellness into my own life and to lead my patients by example. I have wanted to find more fulfillment and alignment and purpose in my nursing career. And as someone who has switched nursing specialties multiple times, I knew that there was something missing, but I couldn't put my finger on it. I even tried my hand at health coaching on the side with a weight loss program for a brief period while I was still working as a nurse full time. And there was just still something that didn't feel aligned. And I knew there was something more that I could do without having to leave the nursing profession altogether. And when I found nurse coaching, it seemed like a sign. I think that the potential for nurse coaching to create change is massive on so many levels. In my own personal life, I think it will give me the space for extreme personal growth and teach me how to prioritize my self-care and in turn be able to walk my clients through that same journey. It was really disheartening and mentally and emotionally draining to feel like I wasn't able to do enough to help my patients in the fullest capacity in my previous nursing role. But by being able to really connect with my patients and have the time and the space to create those deeper connections, I know it will bring a greater sense of fulfillment and purpose in my life. On the healthcare level, nurse coaching has a huge potential to bridge that gap between sick care and healthcare. Honestly, the current healthcare model is not working, and it's more focused on managing symptoms and chronic diseases and not looking at the big picture. And with nurse coaching integrated into the healthcare system, the potential for a more preventative approach, holistic treatment modalities, and an increasingly collaborative environment on the part of both the healthcare workers and the patients is possible. And that's really amazing to think about, that kind of world where that kind of healthcare system exists. And globally, nurse coaching could be what creates this shift in healthcare. When students start to go to nursing school just to become nurse coaches, and there are more professionals trained in this kind of work, the global impact could be astronomical. We will start to create a domino effect. And by promoting health and wellness from the inside out for all humans, that ripple effect into the healthcare system could create the positive change that the world really needs. And especially with everything that's happened in the past 2 years with the pandemic, this is definitely something that could be the answer and could create the shift that we really need in healthcare. So I hope this podcast was helpful to you in helping you understand a little bit more what a nurse coach is, what we do, and how nurse coaching can impact your life. If you are someone who thinks that you would really benefit from working with a nurse coach, I offer free 1-hour discovery calls. And you can reach out to me by either visiting my website, ShawneArceneauxCoaching.com. I will put it in the show notes. Or you can also reach out to me on social media. I'm on Instagram and Facebook at Nurse Coach Shawne. I hope this was helpful, and I'm really looking forward to sharing more with you. So reach out to me, schedule your free discovery call, see if nurse coaching is for you, and I would love to work with you. There's so much that we can create in just one free session. So I encourage you to give it a try. If you have any more questions for me, please send them my way. I'm going to put my email in the show notes. And as always, I am here to support and serve you in the most powerful way I can. It is my mission and my purpose as a nurse coach to be an advocate for self-love and compassion so that I can help you leverage your own inner power and healing potential in the pursuit of a well and aligned life. I'm excited to be on this journey with you. Have a wonderful week. I'm Nurse Coach Shawne. And remember, when all is aligned, all is well. Love you guys.